it's time to answer those tummy tuck questions you guys submitted. So here we go. An extended tummy tuck is just a tummy tuck that goes further around the corner. If you're looking for a butt lift, you're probably looking for a body lift. A body lift is a tummy that goes all the way around, doesn't stop at the sides. So that's the difference. So if you want a butt lift, this is ideal for massive weight loss patients. You are looking for a body lift, also known as lower body lift, also known as butt lipectomy. So the cost is the cost of a tummy tuck plus the cost of the lipo areas that you want to lipo. That maybe upper abdomen and love handles are the common ones. Sometimes people want bra roll, sometimes they want the upper inner thighs. So the fee depends on the number of lipo areas, which exactly the area they are, and the complexity. With a BMI of 23, I suspect you don't have a lot of fat, so it'll be on the lower end of the range that you can see. And for actual fees, check out the fees page here. It'll give you the idea. Ab etching is when you perform liposuction in such a way that you try to accentuate or exaggerate or highlight muscular anatomy underneath. This is typically done as part of liposuction by itself, but yes, it can be done as part of a tummy tuck as well. How to find a good plastic surgeon is really a very difficult topic. I wish I could summarize it really quickly in a couple of sentences, but it's actually pretty complex. You want word of mouth referrals. You want referrals from people you trust, people who've had this surgery done. When you do your own research, you want to find somebody who's got a lot of reviews, who has reviews that seem authentic, who's got the occasional negative review as well. If you find somebody who's got no negative reviews, they either haven't operated, they are not real, or they are suppressing their negative reviews. And finally, you want to look at their before and after pictures, and you want to see a lot of tummy tucks. You want to see results you like, and ideally you see people that look kind of like you in the before pictures. That'll give you an idea of what this person can create for you as a result of a tummy tuck. Price is one of the most common questions we get. I suspect there'll be a lot more coming, so I'll just quickly put a link down here. I already answered it. Check out this link, click it, look at our fees page. The fees page has all kinds of fees. There's a fee for the consultation, there's a deposit for the surgery, there's a fee for the surgery itself, and then understand not everybody is the same, so we don't have one fee for all tummy tucks. The fee for tummy tuck depends on basic tummy tuck or an extended tummy tuck or a vertical tummy tuck. If it's some sort of a revision, if you need liposuction, what type of liposuction, how many areas, what is your BMI, how complex the case is. So there's a lot of variables that go into the actual fee, and they range. It's not a huge variation, but they range a little bit. And again, the fees page is a guide to give you a rough idea. But to get an exact quote, we do need to see in person. You would have to come in for a consultation, be properly assessed, and only then can we give you an actual quote. An extended tummy tuck is really a basic standard tummy tuck that goes a little bit longer. It's ideal for people that have more skin laxity laterally. And if you're wondering whether you need an extended tummy tuck or just a regular tummy tuck, the best way to sort of determine is sit down, look at your tummy, and see how far laterally your skin fold goes. And that's approximately how far the incision goes. Typical tummy tuck kind of goes from hip to hip. Extended tummy tuck kind of goes around the corner a little bit. So that would indicate if you need an extended tummy tuck or regular tummy tuck. But in the way it's done and what's being done, it's all the same. It's really, the difference is in the length of the scar. So I just answered this question, but I'll say it one more time. Sit down, be in a sitting position, look at your belly, and see how far laterally your folds go. And that determines how far the tummy tuck should go. Because if you try to keep it short, if you try to cheat it, then you'll fix the area where the scar is. But if you have folds lateral to where your scar ends, you're gonna leave those folds behind, and it just doesn't look good. It looks unfinished. It looks worse than if you had nothing done. So nobody wants long scars, but if you need a scar, do it properly. Get a proper transformation. Don't get an unfinished product. At our clinic and most other clinics, you should be on the BMI of 30. Over 30, just your risk of complications goes up. And also people that are over 30, very often they need to lose weight. You should lose weight. And the way I explain to our patients is the more weight you lose, the nicer results we can give you. It's that simple. Somebody with a low BMI is always going to look better than someone with a higher BMI. And also, the lower the BMI, safer it is. Now, I know some people have high BMI and just struggle to lose weight. Sometimes we do what's called paniculectomy. It's simply just chop off the extra skin. It's more of a functional procedure in tummy tuck. For other people, we now offer weight loss solutions. We help you to bring your BMI down below 30. So if you're struggling with weight loss and you think of a tummy tuck, try to bring it down. And if you can't, ask for help. And if you're one of our patients, we might be able to help you to bring your BMI below 30. A lot of surgeons do these procedures together. I prefer not to. And the reason is that after a tummy tuck, I want you to be on your back, almost like in a sitting position. After BBL, I want you to be on your tummy, not sitting whatsoever. So while you can do both, I feel like if you do both together while you recover, you're compromising one of the results. If you do them separately, then you maximize the results from both. So yes, it's possible. If you really have no choice, we can do it. But if you are patient and willing to split it up, it will give you nice results if you can have two proper recoveries instead of combine them into one and compromise one or the other. So whether it's a tummy tuck or any other procedure, there's a bit of a wait time. So just a little heads up. Sometimes we get patients that contact us and want to have surgery next week. Realize it doesn't work like that. We book far out, we plan ahead. Generally, the idea is the bigger the procedure, the further out we're booking. So for really big procedures, I'm booking to January, February. Right now, something smaller, I can squeeze in. If you want to get something earlier, don't get discouraged. You can be on a standby list. We always have somebody that needs to reschedule a sick or for whatever reason an opening shows up. Also, we have 3 other associates that are working with us, Dr. Rose, Dr. Constantine, and Dr. Haywood, who can accommodate your schedule if you're trying to get in earlier. So contact us, let us know what's your time frame, and we'll do our best to find some time for you. But please plan ahead and realize that despite our best efforts, we can't squeeze people in last minute. And I'll say this one more time. This is specifically for our Middle East patients. Yes, you guys. Dubai, amazing place. Absolutely love it. Everything's instantaneous. And for most surgeons who have surgeries, that's because they have a lot of availability. For visiting surgeons such as me, please realize that I have a very limited amount of time when I'm in Dubai, and so we need to plan ahead, and you need to be prepared for surgery. So we need to make sure your blood work is good, that you properly optimize, that you took a time off, that you understand what's going on. And it's very frustrating for me when I arrive in Dubai and people see me and they want to have surgery the next day and be recovered the day after. If you guys would like surgery with me, you're in Middle East, please plan ahead, contact us earlier, let us talk, let us set things up so when I get there we can get things rolling. So very simple, straightforward tummy tuck on a skinny patient can take 1.5 to 2 hours. If someone is bigger, if they need additional liposuction, the additional liposuction can take half an hour to an hour. If you're looking at lipo 360, it could be an hour and a half. Again, it depends on the amount of additional work that's required. If this is a vertical tummy tuck, if it's a fleur-de-lis, or if it's a complete body lift, so it varies. But the bottom line is, for you as the patient, it's about 5 seconds. You can close your eyes, next thing you know, you're waking up. That's the beauty of general anesthesia. This is not done awake. You will not be awake for this, not in my hands. So fees down here, I'll just point one thing out. 99% of the time when people are asking for a mini tummy tuck, they usually need a full tummy tuck. Think of a mini tummy tuck as really a correction for the C-section belly pouch on the bottom. Unless that's all that's bothering you, chances are, without having seen you, I would be, if I was a betting man, I'm betting that you need a full tummy tuck. So I'm not saying you can't have a mini tummy tuck, but be prepared that when you're seen in person by me or another surgeon, they may recommend a full tummy tuck instead of just a mini tummy tuck. The pain for a tummy tuck varies from person to person, depending on pain threshold. Everybody's a little bit different, and muscle repair is the most painful part of a tummy tuck. So the people that don't need muscle repair have a lot less pain than people that do get muscle repair. Now, don't let that be a factor in your decision making. Don't say, I don't want a muscle repair because I don't want the pain. We'll give you good pain medication to keep you comfortable. If you need a muscle repair, it's well worth a few days of pain for the long-term result. Oh, I love my glasses. I know I've been getting some criticism from you for this, but for everybody out there, I love my glasses. Unfortunately, stretch marks are stretch marks. There is nothing you can do about them besides cutting them out. That's where tummy tuck comes in. But tummy tuck doesn't remove all stretch marks. It only removes the stretch marks that are below the belly button. So if you look at the pre-op markings, you can make a cut from side to side, like a side to side and then up to the belly button. It's not a square, it's an elliptical shape. So the stuff inside this area is the one that gets removed. The stretch marks that are above the belly button just get pulled down. Unfortunately, there is nothing else for stretch marks. I know there's a million different treatments out there, and every cosmetician out there has some sort of a fancy treatment. If it worked, there'll be no more stretch marks. So my little advice to you guys is don't waste your money on all these lasers and whatever treatments people offer there. They unfortunately don't work. So that is a perfect candidate for a mini tummy tuck. A mini tummy tuck it's not a small version of a tummy tuck, it's really a correction of these C-section scars. It's painful, I won't lie, it's not a walk in the park, but we give you the good pain medications, we give you good freezing during surgery, so while it's uncomfortable, it's not something that's going to keep you in bed writhing in pain. You'll be uncomfortable for about a week or two, but you'll be okay. If your BMI is 35, you would need to lose weight first to qualify for surgery at our clinic. You need to come down to below 30. When you lose weight, you'll be left with loose skin. So when you sit down, you have this fall of skin you can grab with your hands. If you can grab your skin, not with your fingers, but actually with your hands and pull on it, then you're a good candidate for a tummy tuck. It's not common, but yes, you can have it twice. If you have a tummy tuck and then you get pregnant afterwards for whatever reason, your tummy will stretch again. And now that you have stretched skin again, you may need to remove the excess skin again as a tummy tuck. So it is normal not to have feeling below the belly button for up to 12 months, sometimes a little bit longer. But in most cases, feeling comes back. In some cases, it does not. If it doesn't come back after 2 years, it's unlikely to come back at all. A tummy tuck looks best when it's done by a properly trained and qualified surgeon and when you are the right candidate for a tummy tuck. Whether or not you have liposuction depends on whether or not you have additional fat that needs to be sculpted. Not everybody needs liposuction to look good. Not everybody benefits from liposuction. So yes, people can ask for different shapes. Understand, your average tummy tuck kind of looks hooded because you have the skin hanging over. When we do a tummy tuck, we pull on the skin. The skin is really, really tight. You don't have the laxity, the overhang. So a tummy tuck belly button usually looks different than a belly button you would normally think of as a belly button. If you want to see what a tummy tuck belly button looks like, look at before and after pictures of tummy tuck patients, or look at a woman who's very, very skinny, who's got no loose skin, and you kind of see what her belly button looks like. So it's uncomfortable. You need to be in a flex position. For the first 2 weeks, you're hunched over, and people complain of back pain, but the back pain goes away once you straighten out. People often feel bloated for quite a while. People feel numb in the lower belly for quite a while. All of this settles down. Understand you will have a scar. The lower scar can be well hidden with your underwear, with your bikini. The belly button scar is the one that's out there, that's obvious. So just think of that. Understand that some people may be more prone to abnormal scars, such as hypertrophic scars or keloid scars, or more visible scars. Those are sort of the things to think about when considering a tummy tuck. And think, does your belly bother you to the point that you want to have surgery? Yes, once you're fully healed, no restrictions. So I tell my patients not to exercise, not to strain themselves for 6 weeks, and to avoid ab exercises and sit-ups and crunches for 3 months if they had muscle repair. If they had no muscle repair or no hernia repairs, then they can do it after 6 weeks. Never thought about it, but thanks for letting me know. Tummy tuck or any plastic surgery is not cure for weight gain and obesity. So yes, after you had a tummy tuck, you do need to have a healthy lifestyle, eat well, exercise, be healthy, because if you don't, you can gain weight. This is not going to prevent you from gaining weight. I don't know. I don't know. I try to make my belly buttons, look as good as possible. There's variations. There's many different patterns. There's not one that I personally love the best. Belly buttons are actually tough. Talk to any plastic surgeon. I don't think many, if any, have a perfect belly button that I know of. We all struggle with it a little bit. But thanks if you like mine. Thank you. Some people say it's worse. Some people say it's easier. I guess it's just a personal experience, on average, I would say it's the same. Like same amount of people say it was easier, same amount of people say it was worse. It's pretty close. If you went through a C-section, think of it, it's going to be maybe a little bit better or a little bit worse, but similar to a C-section. Still recovering. Her healing process is not finished yet. It takes a while to be fully healed, so I'll say she's still work in progress. Yes, realize tummy tucks don't make you perfect. Plastic surgery doesn't make you perfect. We try to make you better, improved, but not perfect. Weight is not an issue, BMI is. So it's weight versus height, BMI. So if you don't know what BMI is, body mass index, Google BMI or BMI calculator to figure out what your BMI is. Yes, you can always get it low, at least I think I can. Some surgeons tend to have them much higher because they just want to be maybe more conservative. Can you always make it nice? Well, we all do our best, but some people are genetically predisposed to abnormal scars such as keloids and hypertrophic scars, and so despite our best efforts, some people will have not such good scars. Some people have phenomenal scars. I have patients that have absolutely amazing scars, and frankly, I just got lucky. I don't know what I did. I do the same thing for all of them, and some are phenomenal and some need post-op care and treatment and injections. So you're sitting or hunched over for 2 weeks. You're not really doing any strenuous activity for 6 weeks. If you work in an office, you could probably work from home in about a week or so, go back to the office after a couple of weeks. But if your job requires you to be physically active, you want to be on modified duties for 6 weeks. So I guess you're referring to 360 body lifts as the circumferential body lift. We do way more tummy tucks. And the reason is very simple. The 360 body lift, first of all, is not necessary for most people. It's ideal for people who have lost tremendous amount of weight, have a lot of excess skin all around, which is not most people, most tummy tuck patients. 2, most people really care about the front that they see and they don't really care so much about the back. Definitely not enough that they'd be willing to pay double the price, because it is double the price. It's like doing a tummy tuck on the front and the back. Twice the surgery, twice the fee. Always do BBL first, because if you do a tummy tuck first, you kind of throw away your best fat that's often used for a BBL. We can do liposuction out there, or we can do a pubic lift as part of a tummy tuck. Check the link. No, you don't have to combine liposuction with a tummy tuck. If you're very skinny, if you have a low BMI, then you probably don't need it. If you have a higher BMI, you don't need it, but it often helps to make the results look nicer, because a tummy tuck is simply removal of the lower abdominal skin and muscle repair. Liposuction often helps in those situations in heavier patients to thin out the skin in the upper abdomen and to give you nicer love handles, nicer waist curves. While we do have some French-speaking staff in our clinic, unfortunately, most of our staff doesn't speak French. Our nurses don't speak French. So if you think of having surgery with us, you should make sure you have someone that speaks English, so that our nurses who will be looking after you after surgery are able to communicate with you properly, so you can follow our post-op instructions to maximize your recovery. Your BMI should be as low as is comfortable for you. Lower the BMI, safer the surgery, and nice results we can get for you. Wait times, I mentioned this earlier, it really depends on how much surgery you need. The longer the surgery, the longer the wait time. So if something can be quickly done in 2 hours, we could probably squeeze you in much earlier than something that requires 4 hours to do. That's totally understandable. And if you look at our work, I keep my scars very low. I do my best to keep them as low as possible. So while you may see high scars in some tummy tucks, you won't see them at our tummy tucks. Congratulations on your weight loss. At the age of 64, I guess some people may ask, is this too old for surgery? The answer is no, as long as you're healthy. So if you're overall healthy, then you're good to have surgery. If you've lost a tremendous amount of weight, you might need an extended tummy tuck or maybe even a body lift. So if you're interested, contact us, set up a consultation, and we'll be able to provide you with more answers. It takes about a year for scars to fully mature. So initially they look pristine, beautiful. Then between 3 to 6 months, they can become most obvious. They can become raised, hypertrophic, and then over the next several months, up to a year, they continue to fade. In light-skinned people, they become lighter, whiter color. In darker-skinned people, they become darker than the surrounding skin. Absolutely not. If anything, it's going to make your results better. If you're living a healthy lifestyle, you're gonna look better than someone who is living a sedentary lifestyle. Because remember, plastic surgery is not a replacement for a healthy lifestyle. So we do treat diabetic patients in our clinic, but you must be non-insulin dependent. If you require insulin, we don't have the ability to treat you in case you have some sort of insulin problem. We don't have an insulin pump in our clinic. And so yes, you can have a body contouring procedure like a tummy tuck, but it should be on a hospital or facility that's able to treat insulin crisis. So not at our clinic, unfortunately, if you need insulin. If you're non-insulin dependent diabetic, yes, we can treat you, as long as your insulin is well controlled. What would you like to have done? Well, an extended tummy tuck is ideal for somebody who needs extra skin removed from the sides. If you don't need it, you don't need it. We can extend the incision a little bit to avoid dog ears, but it doesn't need to be an extended tummy tuck. So again, extended tummy tuck is not a treatment to avoid dog ears. It is to trim bulging, not dog ears, but bulge. People have extra skin on the sides. Assuming all goes well, you could potentially leave after 2 weeks, but you can't be lifting anything heavy or strenuous for 6 weeks, so you want to make sure that someone else is carrying all your luggage and doing everything. You can get on a plane, fly somewhere nice, hang out by the beach, and just chill. That's about it. So that's it for question about tummy tuck, and now I'm gonna go and get ready. In a little bit, I'm gonna be taping an interview with Kim